Red and itchy spots on the skin can be caused by hives. To have a conversation about urticaria, today we have with us a famous dermatologist
𝐃𝐞𝐫𝐦𝐚 clinic, Mansarovar,
and from our city Jaipur, Dr. Neha Agarwal. Doctor, is COVID related with urticaria?
Any kind of infection can lead to urticaria. Even a simple cold can lead to urticaria, and a serious infection such as HIV can also lead to urticaria. During COVID, many of the patients were having cutaneous manifestations, and out of which most of the patients were having these urticarial lesions. As I already told you, in urticaria, a patient will have this red, itchy, raised area of skin. Usually, the urticaria which was seen during COVID, patients were not having complications due to the urticaria, and it usually resolved within 7 to 10 days or 15 days. If you are having urticarial episodes or you are having urticaria, no need to panic. Just visit your dermatologist and you will get the solution for that. Don't self-medicate yourself, and do not take advice from chemists.
Doctor, is urticaria and allergy similar? And how serious is urticaria in India?
Urticaria is a form of skin allergy, and allergy can be of different types such as skin allergy, seasonal allergy, food allergy, drug allergy. You may have heard of this. The patient may be having this recurrent sneezing, recurrent cough, cold. So allergy can present in different forms. So urticaria is a type of allergy. Urticaria, if we talk about urticaria, in urticaria, patient will have red, itchy, raised areas of skin, and this usually resolves within 24 hours. It can be of different types, two types, acute and chronic. In acute, symptoms will last less than 6 weeks, whereas in chronic urticaria, patient will have symptoms for more than 6 weeks. If we talk about India, then chronic urticaria is more common, and it affects almost 1% of the population.
Doctor, is there any season during which urticaria happens more?
It depends on the trigger for that particular patient. So various kind of triggers can be there for urticaria, such as food can be a trigger. Patients are mostly allergic to peanuts, shellfish, and other kind of triggers may be there, such as dust. Drug can also be a trigger, such as NSAIDs, and other drugs such as antibiotics can also be a trigger. And certain seasons can also be a trigger, depends from patient to patient, such as if a patient is allergic to winter season, then the patient will have more episodes during winter season. If the patient is more prone to develop urticaria during summer season, then the patient will have more episodes during summer. So it all depends, it all varies from patient to patient. So if you are having any of the urticarial symptoms, you should directly visit to a dermatologist and do not self-medicate.
Doctor, how to take care of my skin during upcoming winter season?
Yeah, it is very important to take care of skin during winter season, as winter leads to dryness of the skin. So it is very important to apply moisturizer during winter season. Many of the people don't apply it and don't consider it as a significant thing. After bathing, you need to apply moisturizer on a daily basis and use petroleum based moisturizers, and they are considered better moisturizers during winter season. And apply moisturizer over the damp skin, so it will lead to preservation of the surface moisture. The second point is, do not over cleanse your skin. Use mild detergents, and non-detergent soaps are available in the market, so you can use them. Use lukewarm water for shower, and after bathing, gently pat your skin dry, and then immediately follow it with moisturizer.
Doctor, is urticaria contagious from one person to another?
No, urticaria is not contagious, as it is not an infection. It occurs due to release of histamine from the undersurface of skin. There are various kind of triggers which can lead to activation of mast cells and release of histamine from the skin surface. So these triggers can be, food can be a trigger, certain medications can be a trigger, dust mites, pollen can be a trigger, temperature variation can also be a trigger. Cause of urticaria is very different from other contagious diseases, so it is not at all contagious. However, if you feel like you are having any of these symptoms of urticaria, you are having red, itchy, raised lesions, so you just consult your dermatologist and you will immediately get the relief from these symptoms. And stick to the dose and duration of treatment, whatever your dermatologist is prescribing you, so you will be free from the urticaria.